Hi everyone, this is Martha Law. In this video, I'll be exploring three major topics: paraphilic versus sexual disorders, key insights from externalizing disorders like ODD, CD, IED, and DMDD, and finally, why it's important to understand substance use specifiers when treating addiction. Each of these areas gives us a different view of how emotions, behaviors, and biology interact in mental health. Paraphilic and sexual disorders may sound similar since both deal with sexual functioning, but they're quite different in nature. Paraphilic disorders involve unusual or intense sexual urges that can cause harm or distress, like voyeurism or exhibitionism. Sexual disorders, on the other hand, focus on problems within the normal sexual response cycle, things like low sexual desire or performance difficulties. Both can be emotional distressing, but they differ in what causes that distress. Here's a simple comparison. Paraphilic disorders are driven by non-normative urges or fantasies that might violate consent or cause harm, while sexual disorders involve challenges within consensual typical sexual activity. Recognizing that distinction helps clinicians understand whether the focus of treatment should be on managing behavior or addressing performance and self-esteem issues. Externalizing disorders share one big theme: difficulty controlling impulses and emotions. But what makes them different is the intensity and timing of those behaviors. For example, a child with ODD might argue with authority figures or refuse to follow rules, while conduct disorder tends to involve more serious behaviors like aggression or breaking laws. Here's how each disorder stands out. ODD is often seen as defiant or argumentative behavior. CD is more severe with aggression or rule breaking. IED shows up as sudden, intense anger outbursts that are out of proportion to the situation. DMDD mainly affects children, leading to constant irritability and frequent tantrums. These all share a root in emotional dysregulation, but the context and expression differ. Understanding the differences among these disorders really matters in treatment. Someone with ODD may respond best to parent training and consistent behavioral boundaries, while someone with CD might benefit from programs that teach empathy and responsibility. For DMDD, the focus is often on mood stabilization and emotion regulation. When we tailor interventions to fit the specific disorder, we see much better long-term outcomes. When it comes to substance use disorders, the DSM-5-TR uses specifiers to describe the stage or severity of the addiction. These include whether a person is in early or sustained remission, whether physical dependence is present, or if they're living in a controlled environment like rehab. These details give clinicians a clear picture of where the client is in their recovery process. As clinicians, our role is to match treatment to the person's stage of recovery. For someone actively using, we might focus on detox and motivational interviewing. For someone in early remission, relapse prevention, CBT, or group therapy could be more effective. The Overtaken documentary really drives home how addiction impacts entire families, reminding us that empathy and compassion are essential parts of treatment. Each disorder, whether sexual, behavioral, or substance related, has its own unique challenges. By understanding these nuances, clinicians can make more accurate diagnoses, provide better treatment, and offer care that's both informed and compassionate. The references for these videos were American Psychiatric Association 2022, DSM-5-TR, Memorable Psychiatry Lectures, Internalizing Disorders, Mnemonics, Memorable Psychiatry Lectures, Addiction and Substance Use Disorder, Mnemonics, The Overtaken documentary, YouTube. Thank you so much for watching this video, and I look forward to hearing your discussion as well.